the temptation for the doctor there is to basically, based on those symptoms, is to provide an inhaler and say, well, it sounds like it might be asthma. Go away and try this inhaler. And a lot of the time, then individuals just kind of go, well, doctor says I've got asthma. My tight chest is because of my asthma. And they kind of got some sort of answer. However, if it was asthma, the inhalers usually will sort it out, quite quickly. But it's not uncommon that I say where the symptoms kind of cross over are that basically the breathing pattern disorder and asthma, they do have very similar symptoms. So if an asthmatic is likely to say that when they exercise, they get a tight chest, someone with breathing pattern disorder will say the same thing. They'll say, my chest gets tight. The difference being that maybe if it's exercise-induced asthma, that might usually come on kind of after they've done a hard bit of exercise, or actually after they've finished exercise overall. Whereas the breathing pattern disorder kind of issue will occur during the hard parts of exercise. So they usually experience it during kind of a high intensity piece of exercise. And then as soon as they stop, within kind of 2 or 3 minutes, their breathing and their tight chest has disappeared. So the breathing pattern disorder is usually more acute in terms of the symptoms. So other common symptoms are difficulty breathing in, difficulty recovering between efforts. Those are all quite common symptoms of breathing pattern disorder, but I'm sure individual with exercise-induced asthma would report similar symptoms. And the only way to differentiate between the two is to do some objective testing. The difficulty is within most, especially in the UK, within kind of the national healthcare system. At the moment, because there's been a backlog from COVID, it was 5 years after COVID, but there's still a massive backlog in accessing tests that allow medical professionals to actually see kind of how well someone's lungs are functioning. And so, someone who might go to a GP today, depending on where they live, it might take them over a year to get a spirometry test to actually kind of investigate them for asthma. So they might be waiting quite a while, maybe using inhalers that might not be working for them. And actually what they need is some support with their breathing pattern to help them overcome their breathing pattern. And the reason why an inhaler doesn't improve a breathing pattern disorder is because the inhalers kind of help open up your airways. They help reduce the inflammation in your lungs and open up the airway, whereas a breathing pattern disorder is caused from sort of mechanically the way you're trying to move your rib cage. So it's more about the coordination of your respiratory muscles and the movement of your rib cage, and also linked to that potentially the way you hold your posture and the anxiety and stress about breathing. It's more of a technique to learn, so more of a skill rather than needing an inhaler to overcome it. And then,
Right.
And I mean, the other side of it as well is that there's a bit of gray zone in the middle where we'll come across a lot of athletes that have asthma, but they'll also have a breathing pattern disorder. So then you got then you have to kind of work between the two. But hopefully that describes a little bit how they differentiate.